Hi everyone, welcome to our week 2 summary. I hope everyone had a good weekend and just wanted to go over a few things from week 2 and discuss some of the questions that were missed in the week 2 quiz. Our discussion last week about intrinsic rewards. Really great discussion. Thanks so much for everyone that had shared some of their own personal rewards, either within or outside of the healthcare setting. Such great stories, and I really appreciate that. I think that those are the types of discussions that really make our discussion board so much more exciting. So I really do appreciate you sharing those types of discussions with us, and it really is, to me. I mean, it's great if someone hands you a $20 gift card to Starbucks because you can go and get a nice drink before you walk into work or something like that. That's going to be an extrinsic reward. But those intrinsic rewards, be it for those of you that work in a clinical setting, being able to save a life, or being able to really help out a family, or even just the reward of having a manager take your advice or listen to your advice, or being able to work with your team, be able to have that real one-on-one with your staff, or just feeling that you're really contributing. Those are all really important intrinsic rewards that we can get from our work, be it work in healthcare, work outside of healthcare. And the one thing I think that you'll notice throughout whichever program you might be in, it could be health service administration, could be nursing, could be nuke med, it could be any of our programs here at RMU. I think the one thing that you'll notice is that so many programs, either inside or outside of healthcare, it could be business, any program, it all comes down to serving your customer. So it could be a patient, it could be your coworker, it could be internal stakeholders, external stakeholders. It comes down to serving your customer. And when we are happy and engaged employees, we serve our customer more effectively. So this week, one of the things that we'll talk about is leadership, and we don't have to be managers to be leaders. We can always lead from the seat we're in. And I'm a big proponent of leading from the seat we're in, leading from the seat you're in. Be that leader. Share your knowledge. Share your information. And when you are engaged in that way in your work, even if you're just coming into an organization and you're entry level, if you are engaged and show your leadership that you are engaged, you're likely to, number one, be a happier employee, and number two, make those moves up through your organization. So great discussion this week. I really enjoyed it. Please make sure that you're engaged in our discussions. Make sure everybody is posting, and post. Obviously, you want your first post up by Wednesday. Additional posts need to be up by the end of the week. And you want to be posting at least two additional posts. Feel free to post as often as you want. At least two additional posts by Sunday at the end of the day. So just to talk a little bit about the quiz that we had. So there were 4 questions that I'm going to go over. People did really well on the quiz overall, but I'll just go over 4 of the questions that were missed. So the first question was, what main purpose was served by an almshouse in the pre-industrial period? So I won't review all of the answers. There's a few answers here, but the correct answer was D, that it performed general welfare and custodial functions. So an almshouse wasn't for like quarantine or those types of settings. It was really just for people to go to for welfare and custodial functions. And I kind of liken it to now we have assisted living. So people can go there and live, and it provides that welfare custodial function for them, but not necessarily to provide an advanced level of care. It really just is to provide a safe setting for someone to live in that may not be able to live alone. So that's what that was at that time. The second one I'll talk about, physicians and hospitals in the U.S. began consolidating and integrating mainly in response to. There were four answers. They're fairly short, so I'll read these. It was A, increased government regulation, B, pressures to contain costs, C, the growth of managed care, and D, the demand for higher quality. Now, one could say, oh, it could be any of those. Our answer, based on the information in our textbook, our answer was the growth of managed care. And this is because with managed care, what it did was it really gave the insurance side of the house, the payer side, it really gave them a lot of ability to um, kind of that buying power. They really had a lot of power from that side. So it needed, you couldn't have so many, a ton of different single, one, two, three doc practices or a ton of independent hospitals. They really needed to consolidate on their side to try and combat the buying power that these insurers had with managed care. So by kind of coming together on the provider side, they were able to kind of combat that growth of managed care. So that's when we started to see the large, kind of consolidation of, of providers with physician practices being bought up by hospitals and hospitals coming together. Mainly, sadly, because hospitals and physician practices weren't able to survive on their own with the decreased reimbursement in the managed care setting. So by coming together, they were able to themselves negotiate better rates, decrease their costs overall, and and be able to survive as a larger group together. So that was that question. The answer was C. Next one, supply side rationing is also referred to, uh, and the answers were A, non price rationing, B, price rationing, C, planned rationing, or D, both A and C. So our answer was D, both A and C, because supply side rationing is referred to as both non price rationing and planned rationing. And what supply side rationing is you can see that a system can kind of work in two ways. You can have a rationing system, and we don't really want to think about rationing in healthcare, but unfortunately it does occur at times. You can have a system based on market justice, and you can have a system based on social justice. And currently, really, our system is for the most part based on market justice. The people that can afford to get care. And so it's more of a price rationing system. If you have insurance that will pay for an MRI, then you will get an MRI. Otherwise, you need to have cash to pay for your MRI. Under a non-price rationing system or a planned rationing system or a supply side rationing system, they are all the same thing. That is a social justice system where the government would actually ration these care items based on the need. So if someone needed to have that, and we do have that to some extent through programs like Medicaid and other social programs where there is some supply side rationing for those types of services for patients that are in need of those. But it's the bulk of our system overall tends to be more of a market justice based system, with the social justice side kind of being what people are crying for. Many people are crying for. I'm not going to generalize the whole country because I don't think that's the case, but many people are crying for a more social justice based system to provide for wider coverage for those that cannot afford health care. So there's the side of the country that's crying for more socialist-based universal health care, and then there's a side of the country that is really wanting to keep our healthcare privatized. So there's two sides to that coin. And depending on the day, I could be on one side or the other. I guess it would. So I don't really have an opinion one way or the other on it most of the time. I just want our system to work in a more efficient manner. So that's what our answer here is. Supply side rationing the answer is D, both A and C. Last question is in the U.S., public health and private practice of medicine developed separately because, and the answers here are long, so I won't read them all, but the answer was B. Physicians were skeptical of the government taking control of medical practice. And you will notice this quite extensively that you have kind of your public health departments, and then obviously you have the private practice of medicine. And many public health practitioners, and obviously your public health department, is very separate from obviously our private health side of the business. And you'll find that they kind of don't. They're very different. The practice of public health and improving public health, epidemiology, all of that is one side of the operation. The private practice of medicine is different. And as we look at improving population health, and we'll talk more about that, talk a little bit about it in this class, but those of you that are part of the Health Service Administration program will definitely talk much more about that as we move through our program. As you talk about improving population health, the public health and private health sector really need to come together to try and make those improvements in population health. But because physicians were very fearful of losing control of their practices, those two really were very separate. So it's an interesting dichotomy, but not unrealistic because government, a lot of people fear government control of their industry and whatnot. So that's the last one. If you have any questions on any of the other quiz questions, you can always go back into your quiz and take a look at the answers. You can't look at that until after the week is over. So if you tried to look at it before, maybe you took the quiz midweek, tried to go back in, you can't look at it until after the due date. But once the due date is up, you're able to go back into your quiz and look at your answers. So please take the time to look at those. But if you are unable to find it in the book, you're unable to find that information, please just let me know. And I look forward to working with everyone this week. I'm still missing a few responses on our Google Hangout, but hopefully I'll be able to get those this week. I'm going to follow up with some people, and I'll get the dates out on that. We'll have 2 different dates, and hopefully we'll be able to move forward on that very soon. So everyone have a good week, and I'll be talking to you in the discussion boards. Thanks.